The slides presentation talks about the Sheets et al. Article that was published in 2007. And in this article, the authors define a movement system diagnosis for patients with neurological injury. And actually, the idea of a movement system diagnosis isn't new. It was first identified in 1999 by the Sheets author, as well as the following paper. This one, published in 2007, refines the movement system diagnosis, and this is actually where the PT profession is moving toward. As you know, the movement system is the hot topic for physical therapy these days, where physical therapists are the ones that are responsible for diagnosing and treating anything that has to do with the movement system. And as you can see from this slide, the picture on the slide, the movement system is composed of endocrine, nervous, cardiovascular, pulmonary, intake, as well as musculoskeletal systems. Okay, the reason why this is so important and why this is such a hot topic in physical therapy today is that physical therapists need to be treating movement system dysfunctions and not medical diagnoses. I'll give you an example of that when it comes to neurological injury. So if a patient has had a stroke, we are not treating the stroke. We are treating the problems that the stroke, or the movement system problems that the stroke has caused. In this particular paper, the authors have outlined a series of 9 different movement system diagnoses. And I think the most important thing that I want you to get out of this paper is in Appendix 1. So if you just want to go ahead and, let's go ahead and check out Appendix 1. And what I've done here is, for all of the movement system dysfunctions that are listed, I have gone ahead and highlighted in yellow the key tests and signs that I'd like you to be aware of that are associated with this movement system dysfunction. So for example, diagnosis here is movement pattern coordination deficit. These patients you would expect, probably most importantly, to have during gait variable foot placement or line of progression, or maybe guarded with slow, small steps. Okay, they're going to have difficulty controlling force relative to task demands. Their postural control is going to be latent. As far as coordination tests, they're probably going to demonstrate some sort of ataxia here. Okay, moving on to force production deficit. Just as it sounds, these are individuals who have weakness. Okay, a significant amount of weakness. And as you can see, I've gone through and highlighted all of the key tests and signs that I need you to be aware of, as well as associated signs that you might see. Okay, for each of the 9 diagnoses, please just go through and look at the areas that I've highlighted, because right now I'd like you to focus on the examination portion of this paper. Later on, we're going to look at this paper again, and we're going to look at ideas for interventions based on the movement system diagnosis that has been assigned.